COVID infection now is sort of pan-India. It has gone to smaller cities and it's also gone to some parts of rural India. And the numbers therefore have continued to increase. This is to some extent expected because as we move ahead from it being localized to large metro cities where the infection first came in from abroad, it has now spread to other parts of the country. And considering the population that we have, and the vast distribution of this population, the number of cases will rise to some extent before they flatten out. We will have a huge number of cases. It's only that if you were to look at the number of cases per million population, that you could say that our numbers are not that much, but in absolute numbers, we will actually have a huge number of cases. Yes, so we are seeing a resurgence of cases. We could say that we are seeing some sort of a second wave in certain parts of the country. And I think there are multiple factors for that. One factor is that, of course, our testing has gone up dramatically. We're doing more than 1 million tests per day. And in areas where we test more, we will definitely pick up more cases. But I think a more important factor is that we've, as a population, gone into what I would say is a COVID behavior fatigue. That a lot of us who were very strict or very compliant in terms of the COVID appropriate behavior when we had the initial lockdown have sort of reached a situation where we have had fatigue, where many people have just said enough is enough. And if you now go out, you will notice that even in Delhi, people are not wearing masks. People are still crowding together. They're still there. We are back to the traffic jams that we were seeing in the pre-COVID era. Yes, I don't think that we could say that the pandemic will finish this year. What we could say is that we will be able to keep the curve on a flatter side rather than rising very steeply by our interventions, so that we don't have an overwhelming of our healthcare facilities or we don't start running out of beds. But the number of cases will continue like this or for some more time. We may see a gradual drip, but that will take a few months before we can say that we're really past the pandemic.